Welcome. My name is Shannon White, and I'm the pastor here at Wilton Presbyterian Church. Today we're going to hear from Linda Rost in this interview, which has been, the funds of which have been provided by a mental health ministry grant through the Presbyterian Church USA. I'm delighted to invite Linda Rost, who has been a long-term member of Wilton Presbyterian Church. She's an LCSW here in Wilton and is a co-coordinator of the Fairfield County Trauma Response Team, which we'll hear about in a moment. So welcome, Linda.
Thank you.
So, Linda, tell us what you do. Tell us about your work as a therapist as well as with the Fairfield County Trauma Response Team.
I have been working in the field of trauma for about 35 years, I guess now, starting with survivors of sexual abuse. And gradually there came into being a new form of therapy called EMDR, which was specifically developed for trauma. With that, I connected with a group of similarly minded therapists, and we began to form a group. And we started as a team in 2011, working with what I'm going to tell you about is big T trauma. There was a fire in Stamford where there were 70 firefighters present. It involved the death of children. The house burned down to the ground. There was no rescue. There was only recovery. And the firefighters were exposed to terrible sights and sounds and smells. They got back to the firehouse. It was Christmas Day, and they called their employee assistance program and said, we need some help here. We need some debriefing. Our people are traumatized. And the response was, well, the staff has just changed, so we don't have anyone assigned to you. And it is Christmas Day, so why don't you give us a call in a week or so? Fortunately, one of the very wonderful captains who now presents with us in the area of trauma was married to one of our clinicians, and that's how we got started. So that's an example of a big T. We also talk about little t's, which most of us have. Sometimes we metabolize them, and they just sort of, move along in our brain, and sometimes we don't. But we don't always know it. We don't always know that they're stuck there. So when you have a situation, as we do now, where there is isolation and a feeling of being destabilized in some way, it can really take you back to earlier experiences where you had the same kinds of feelings and thoughts, so that you're not only responding to the present situation, but also to the past. If there are any messages I'd like to leave you with at the end of today, it's one that post-traumatic stress is no longer called a disorder. It is a brain injury. It is a normal response to an abnormal situation. And the second item I'd like you to remember is that all our experiences are linked. So as an example, when you're responding to what's going on now, it may bring back a memory that you've had before. I present a lot in my role as co-coordinator of the trauma response team, really all the time, because that's what we do for first responders, that and treatment. And I was thinking, this in some way feels very different to me, having to do this today. And I realized as I was thinking it through that it's because I feel destabilized myself. I feel my focus is off. I feel my attention is not what it should be. I feel that I wander around not knowing really what I'm doing. I miss my family. I miss my church community, and it takes me back sometimes to other experiences where I felt alone and where I felt destabilized and very, very sad. So if you're experiencing those things, don't think you're crazy. Again, it's a normal response to an abnormal situation. I was working with one nurse who was talking about the difficulty she was having dealing with the realities of living in a pandemic, even outside the hospital, not being able to see her family, having talked to them the week before and being very concerned about her niece, to whom she's very close. And it brought back, because of her fears about this child, it brought back her own history of childhood sexual abuse. So we weren't talking about COVID. We were talking about her memories of childhood sexual abuse for the first time ever, and this woman is in her mid-30s.
What can you say about the trauma of the medical community right now?
It's been particularly hard on nurses. They are the ones that are sitting with the patients who are dying alone and trying to keep their own stuff together. Especially, and then the administrators are struggling too, because, you know, like you, Shannon, as a pastor, and myself as a therapist, we have a hard time asking for help, and we have to take care of other people. So we can't go around emoting, except maybe in the privacy of our homes, to our loved ones. We have to be strong, and that's what these administrators are feeling.
Do you anticipate after COVID is over that the trauma will still unfold?
Absolutely. Absolutely. Family relationships have changed, some for the better, I will say. Some not so much for the better, because there's a very high divorce rate right now. I think that a lot of us will never feel truly safe again. And we're going to have to redevelop our trust in the institution of our government. And there's going to be a whole generation also who are disenfranchised. I'm talking about Black and brown communities who are often, not always by any matter of means, but often disenfranchised from the educational system, who don't have access to the internet, who are going to be left behind, who will not have social skills. Even children who are not impoverished have not been going to school, learning online. That's not normal for a 5-year-old or a 4-year-old. Where are they going to catch up on their social skills? And these poor parents who've been dealing with having to educate them and try to work and try to earn a living. It's going to take us a very long time to recover.
Where's the hope?
Where's the hope? We have each other. I've seen a lot of kindness. I've seen a lot of reaching out, despite how beaten up we all feel. I feel that there is hope in things that you can do for yourself. Get out of your house, go into the fresh air, walk in nature, move your body, exercise. Try something new, try something that you've never done before. And tell yourself that it's okay, you're not okay, that you're not crazy. The hope is that we will come together. I think it's going to be very joyful. I don't think it's going to be a fast process.
So, is there any place for faith and the church in this to help people recover?
We were very active after the Sandy Hook shootings in Newtown, and I found with my own patient load from that disaster that the people who had a strong faith did better in treatment than those who did not have that support in their lives. I've learned to ask that question in my intake. Do you have a faith institution in your life? Is faith part of your life? And that's something that I didn't do for many years because it's not really cool to talk about faith in the mental health profession. At least it hasn't been historically. But I feel that that's a really critical question to ask.
If someone were watching this today and identifying in themselves some areas of trauma, what should they do?
Well, I think it's very helpful to seek out a trauma-informed therapist. We are all trained, this group, in EMDR. There are other people that are not part of our team who also have those skills, but it's important to find someone who's trauma-informed. And it's a quick therapy. You don't have to lie on the couch and talk about your relationship with your mother for 10 years. This is a brain injury, and we treat it as a brain injury. If I had slides with me, I could show you slides that show a traumatized brain versus a non-traumatized brain or one that's been treated. So this therapy, I won't go into all the details of it, but it clears the neurological trauma that's been stored, and it moves it to a more adaptive level of functioning. The good news is your brain's natural inclination is to heal itself. And this therapy gives it a jump start. And it's quick and it's effective. And I really advocate it for people, and I really urge people not to feel shame around needing help with these issues. None of us are immune, including therapists and pastors.